What about for those people who need a lot of skin removed? We're going to do something more extensive than just a standard tummy tuck. We may do something called a trunk plasty. This is going to be for like the massive weight loss patient. So what a trunk plasty does, so if this is the abdomen, the belly button's here, rib cage edge is here, breasts are here, or chest. For someone who's going to get a trunk plasty, they need skin removed in lots of directions. So not only do they have extra skin hanging down here in the pubic area, they also have extra skin on the sides that often hangs down, and they'll have extra skin here in the upper abdomen. What that means is you could take your hands and pinch right here in the upper abdomen and you would feel extra skin. So what a trunk plasty is it's like an abdominoplasty extension, big time. So for a regular abdominoplasty, remember, we remove the skin here, the skin between the belly button and the pubic bone that you can pinch. For a fleur-de-lis abdominoplasty, we'd extend that. We'd remove skin in this direction, so skin you could pinch this way. Take it even further with a trunk plasty. This is like a corset trunk plasty. The effect is to really corset things in. And we remove skin in this area as well. And that extends onto the back. So what you end up getting is you get this skin over here and this skin over here, and you pull it together after you've removed all the extra. So essentially, the skin that's on the back comes around to the front. This is a really dramatic contouring effect. You can imagine that all this extra skin on the side gets taken away, all this extra skin on the bottom gets taken away, and any extra skin hanging up here under the breast, under the chest area gets taken away, creating a really narrow, really well contoured waist. Now, the downside of this is scarring. So with a trunk plasty, you are going to get quite a bit of scarring. Scars are going to look something like this when you're done. If your chest is here, scar is going to go across underneath that breast fold, straight down, and then a tummy tuck scar in the pubic region. Your belly button is going to be brought out in the middle of that scar right there. So again, like kind of a big I, letter I, scarring, but you can imagine this waist is going to be really nice and narrow. You're going to get the best contour result. So this is for someone who has lost a lot of weight and really is willing to take the scars to get the contour. Same as with a tummy tuck, abdominoplasty. These muscles in the midline, your abdominal muscles, which are typically going to be located way out here, not together in the middle like they should be, are going to be tightened and brought back together to the midline. That's going to help that corset effect. So now we brought the waist in, and then we've also brought the skin in, so the waist is really going to narrow. So it's a good way to contour things. And that is the trunk plasty, sometimes known as the corset trunk plasty. Great operation for someone with a lot of extra skin.